So currently I've just started a new role with an art show up here in Mullingu, which is in Mareeba, and I've become the General Manager of Health Services at Mullingu Aboriginal Corporation. I have a long history as an Aboriginal health worker within Archo and Queensland Health, and that is where my passion is, working with mob and for mob.
So my current role, I've had the privilege to be able to advance my career, but I owe it to my grounding as an Aboriginal health worker. I currently am a senior project officer at the New South Wales Agency for Clinical Innovations, one of the pillars of New South Wales Health, but always at the core, I champion and advocate the important aspects and roles our workforce play out there in generating innovation, thinking and understanding of how to improve the New South Wales health system.
In my current role as an Aboriginal health practitioner, I have the opportunity to work right across the nation. I work for the University of Melbourne, I work for the University of Western Australia, contributing to improving eye health outcomes for communities right across this country. But the role that I really enjoy is that as an Aboriginal health practitioner at the Daily Vision Centre. It's an eye clinic that we set up here in our community to be able to respond to the health needs and particular the vision needs of our community. And so it's a chance for me to provide not only clinical services, but support and train up trainee Aboriginal health practitioners coming through the system and wanting to develop their skills and their ability to be able to contribute to our community as well.
Yep, I'm the Director of Innovation Training at Aboriginal Health and Medical Research Council of New South Wales, and I run their RTO, which is recognised as the Aboriginal Health College.
I'm not actually a health worker, but over time I've been involved with health, and I worked with a lot of Aboriginal men in the health arena. I actually, with Peter Panqui and Warren Locke, we started the Nazi Whip because we thought everybody else had a national body and we needed something to support our people, especially our frontline health workers. We did that back, I think, about 11, 12, maybe more years. My current role is I'm sort of semi-retired academic, being a researcher, being a manager of Aboriginal Community Control Health Service, Health Council, chair of NACHO, been a lot of research and a lot of publication on men's health. So that's where I'm at the moment.
Currently, I'm employed as an advanced health worker at the Townsville University Hospital. I work in the First Nation Patient Journey Hub, which is a fairly new unit within the hospital, and we focus on engaging with the Aboriginal Torres Strait Islander patients who present to the emergency department who do not wait to see the doctor. We then engage with them out in the community and try and get them to go to community services so that they can get that issue that they presented to ED with resolved, or at least managed and under control. And we will also get them signed onto the service and help them manage and maintain their healthcare until they can look after their health themselves, which and then we'll discharge them from our service. And hopefully by that point in time they have good health literacy and are able to manage their own health.
I am a Aboriginal health researcher at the Adelaide Rural Clinical School with the University of Adelaide, and I also volunteer at a local general practice in Port Lincoln as an Aboriginal health practitioner.
So my current role, I've just moved as the Executive Director of Aboriginal Health for an Aboriginal primary health care service called Parnham, where I was responsible for 4 Aboriginal medical services. And today, only last week during NAIDOC week, I was just announced the Chief Aboriginal Health Officer for SA Health. So now I'm actually responsible for ensuring that our mainstream system is accountable to the Closing the Gap reform that's happening here in Australia.